Atul Gawande, Being Mortal, Medicine and What Matters in the End. Welcome to the gripping journey through Being Mortal, Medicine and What Matters in the End by Atul Gawande. This essential read delves deeply into the realms of aging, disease, and death, which we know are inevitable yet seldom dare to openly discuss. In this book summary, you'll learn how the natural processes of our bodies breaking down pose challenges to our independence, and how medical breakthroughs have altered our life expectancy and traditional perceptions of caregiving. You will discover how rigidity in modern institutions often fails the emotional and psychological needs of the elderly and terminally ill, causing them to lose a sense of autonomy.
Embracing aging and death. Death and disease are inevitable aspects of life that everyone encounters as they or their loved ones age. As our bodies age, our organs begin to lose their strength and efficiency, leading to issues like high blood pressure, muscle weakness, and cognitive decline such as dementia. The aging process can make it difficult to maintain an independent lifestyle, eventually requiring assistance from family members or medical professionals, potentially resulting in moving to nursing homes or hospitals. Acknowledging and discussing the realities of aging and death is essential in order to explore ways to make the experience less painful and prepare ourselves and our loved ones for what lies ahead. Evolving realities of aging. With the advancements in modern medicine, people are living longer than ever before, leading to a significant shift in the demographics and structure of societies. The new generation is more geographically dispersed than ever, and contemporary healthcare settings provide a clean environment and necessary care, unlike their historical counterparts. However, these modern facilities often lack the personalized attention and emotional support that was once provided by the closely knit families of the past. As a society, we have come a long way, from the days when catching a disease after 50 typically meant a swift demise to now having a growing population of elderly individuals, all thanks to breakthroughs in medical science. The number of elderly people has soared from a mere 2% to 14% in the United States in the past 200 years, with countries like Germany, Italy, and Japan witnessing a 20% elderly population. These changes in life expectancy have not only transformed how we live but also how we die. In the past, generations of families stayed together, enabling adult children to care for their aging parents. This allowed the elderly to spend their last days at home, surrounded by loved ones and engaging in their routine lives. Sadly, the less fortunate without any family often faced their final moments in squalid conditions of poorhouses. The modern era has brought a significant change in this perspective. The percentage of people dying at home in the U.S. has dropped drastically from a majority in 1945 to only 17% in the 1980s, and this trend continues. The reason for this shift lies primarily in the dispersion of families. Adult children frequently live far from their parents, making it challenging to provide full-time care. To fill this gap, nursing homes and hospitals have become the primary caregivers for the elderly. These facilities provide a safe and hygienic environment, a far cry from the deplorable settings of the past. However, they often fall short in understanding and catering to the emotional needs and desires that the elderly hold dear towards the end of their life journey, something that was once fulfilled by their close-knit families. Embracing change and aging. The journey of life offers unparalleled freedom during youth, with independence as a fundamental value. As time passes and old age draws near, the body and mind impose new limitations, forcing us to reevaluate and adapt to new constraints. Nevertheless, we continue to strive for autonomy, seeking purpose and value throughout our lives. Our focus shifts from seeking novel experiences to appreciating everyday pleasures, cultivating deeper connections with loved ones. As medical institutions often fail to address the emotional and psychological needs of the elderly, it becomes essential to embrace the changes brought by aging and maintain a sense of contentment and fulfillment. Beyond basic care for elderly. Old age homes are often viewed as dull and depressing places, mirroring the reality of boredom and loneliness elderly residents typically endure. While these institutions provide essential care and security, they usually lack the warmth and appreciation required for a true sense of belonging. Due to regimented routines, infringement of personal autonomy, and a shortage of specialized geriatricians, elderly residents are left feeling unvalued and unfulfilled. Families may provide the best alternative for care, but managing the needs of the elderly is challenging, and sometimes even our loved ones might not make the best decisions for us. Old age homes are commonly associated with dreariness, and unfortunately, there's truth to that stereotype. Many elderly individuals experience boredom and isolation in these environments, even as caregivers diligently fulfill their medical requirements. The strict routines in nursing homes and intensive care units often rob people of their autonomy. Residents grapple with an abrupt loss of freedom and privacy, while caregivers, pressed for time, find it easier to take charge of tasks rather than helping their patients maintain independence. Though elderly care institutions provide essential services, they frequently fail to create an atmosphere where residents feel truly appreciated and at home. This sense of inadequacy primarily stems from the lack of personalized warmth and understanding accorded to residents. One reason for this shortfall is understaffing, as nursing homes face a constant shortage of geriatricians, doctors who specialize in treating older adults. Consequently, overwhelmed healthcare providers can barely find the time to help their patients feel valued beyond the basic care they provide. Currently, families bear the responsibility of offering an alternative to institutional care. However, managing the individual needs of elderly loved ones is a demanding task, and even the most caring families may not always make the best decisions for their elders. Balancing hope and reality. In the United States, 25% of healthcare costs go towards treating patients in their last year of life, despite them making up only 5% of all patients. Often, these treatments are futile efforts to prolong life, resulting in a diminished quality of life. Both patients and doctors can be swayed by hopeful delusions for a miracle cure. More than 40% of oncologists admit to offering treatments they believe are unlikely to succeed. This can lead to terminally ill patients choosing harmful treatments that sacrifice their well-being for a small chance at more time. A study by the American Coping with Cancer Project found that terminally ill patients who stopped intensive treatment and spent their remaining days at home or in hospice had a better quality of life. The challenge lies in making decisions regarding the battle against terminal illnesses and understanding when it's time to prioritize the quality of life over the quantity of days left. Redefining elderly care. Modern medical care often lacks personal touch when tending to the elderly, and a shift towards alternative care methods that promote individual autonomy is necessary for a more humane approach to aging and death. Assisted living facilities, for example, offer a more flexible approach to elderly care, respecting individual needs and preferences. Similarly, creative solutions such as incorporating nature and intergenerational interactions in care facilities can revitalize their residents and instill a sense of purpose. Furthermore, a stronger emphasis on high-quality hospice services can vastly improve the final stages of life for the terminally ill, emphasizing emotional well-being over medical treatment. Honest communication between patients, families, and doctors is key to better understanding and addressing individual desires and necessities. Redefining elderly care begins by acknowledging the shortcomings in today's medical care system when dealing with aging and death. Older people desire autonomy, compassionate assistance, and unique support tailored to their individual needs. Assisted living facilities are a step in the right direction, offering more freedom, personal space, and choices compared to conventional nursing homes. However, exploring other innovative approaches to elderly care is also critical. For instance, a New York nursing home uplifted the lives of its residents by introducing a garden, regular visits from kindergarten children, and various pets. The increased interaction with nature and different generations instilled residents with renewed purpose and joy, resulting in reduced prescriptions and a lower annual death rate. Similarly, hospice services, catering to the terminally ill, must be expanded and enhanced. High-quality care should prioritize helping individuals live their remaining days to the fullest, rather than focusing solely on medical treatments. A strong emphasis on empathetic understanding and open communication among patients, families, and medical professionals is crucial in meeting these goals. Addressing aging and death with a more humane, personalized approach will lead to improved elderly care, ensuring a greater sense of dignity and fulfillment in the twilight of human life. Balancing compassion and professionalism. In the complex world of doctor-patient relationships, particularly when dealing with terminally ill patients, doctors must balance their professional knowledge and natural empathy for the best outcomes. They should provide well-rounded guidance, neither authoritarian nor purely informative, and aim to address the unique priorities and needs of each patient. Understanding the activities that matter most to patients can help doctors recommend treatments that best support their quality of life. While discussions about assisted death remain highly controversial, doctors should strive to improve their listening and communication skills to better serve their patients as they navigate the challenges of aging and dying. Embracing mortality's wisdom. Addressing the inevitability of old age, illness, and death can be liberating and empowering. By engaging in open conversations with loved ones about end-of-life preferences and what makes life meaningful, we gain clarity and control over our final moments. This acceptance enables us to design our dying role and leave a lasting legacy, ultimately transforming our mortality into a meaningful experience. As we navigate the journey of life, the topics of old age, illness, and death often instill fear and trepidation. We tend to delay such discussions until we face emergencies or loss, putting us in positions to make hasty decisions and denying us the opportunity for a dignified farewell. To break free from this cycle, we must address these questions with family and friends proactively. Engaging in conversations about our end-of-life desires and contemplating the most important aspects of our final hours can help us discover what makes life truly worth living. While it's not necessary to have immediate answers, such discussions bring clarity to our thoughts on aging and departing from this world. This clarity becomes crucial when others assume the responsibility of making decisions on our behalf. Embracing our mortality and acknowledging its reality can be empowering, allowing us to retain control of our lives until the very end. By accepting death, we can create a dying role, which grants us the ability to determine what we pass on and how we will be remembered. When confronted with terminal illness, people can still leave lasting legacies. For instance, a piano teacher with advanced cancer used her remaining strength to give each student one final lesson, ensuring her teachings would continue to resonate through their music. By openly discussing and accepting the natural progression of old age, illness, and death, individuals, families, and societies can transform the painful experience of mortality into one filled with meaning and purpose.
It is apparent that the key to aging gracefully and dying with dignity lies in embracing the realities of mortality and discussing the difficult questions involving how we envision our last days. Models like assisted living and alternative housing options, along with improved hospice care and better communication between doctors and patients, can enhance the quality of life in our final years. As Atul Gawande points out, if we are open and realistic about our needs in old age and how we want to leave this world, we can ultimately regain control and purpose, both as individuals and as a society. By transforming our conventional notions of caregiving and confronting the difficult topics of old age and death, we can reshape our experience and derive meaning from our final moments.